The American Academy of Ophthalmology notes September as Healthy Aging Month to raise awareness of the signs and symptoms of vision loss. Today we're speaking with Dr. Stephen Anderson from Wolfe Eye Clinic about steps to help take care of our sight as we age. Good morning, Dr. Anderson.
Good morning, Megan. Thanks for having me.
Well, this is such an important topic. What does Healthy Aging Month mean for adults and seniors when it comes to their vision?
Well, according to the American Academy of Ophthalmology, 1 in 6 Americans aged 65 and older have a vision impairment that cannot be corrected by glasses or contact lenses. And we know that the risk of eye disease increases with age. And the purpose of celebrating Healthy Aging Month is to bring attention to taking care of our eyes as we age and maintain good vision.
And what are some of the more common eye conditions that can cause loss of vision as we age?
Well, cataract is a common condition. Glaucoma and macular degeneration are common conditions among many others. But to go into some detail on that, cataract is a clouding of the natural lens. It's a very typical thing that happens as we age. It's a bit like looking through a dirty window, and they tend to be progressive. They cause blurry vision, glare, overall decrease in quality of vision, and they can be diagnosed by your local eye doctor. And when they reach a point where they're bothering a patient's vision, it can be referred in for evaluation for possible cataract surgery. And the good news with cataracts is it's a reversible form of vision loss. Cataract surgery is a very successful surgery. Basically involves removing the cloudy lens and replacing it with a new clear lens. And it does work quite well for most patients. Many patients with the technology that we have available today with lens implants actually have better uncorrected vision after surgery than they had before.
Oh. What about glaucoma?
Well, glaucoma is a little trickier. You don't have symptoms with that, and the key with glaucoma is to be diagnosed and treated early if you have it. Glaucoma is a condition that's usually associated with higher than normal eye pressure, and it causes damage slowly to the optic nerve over time. And the damage due to glaucoma is permanent. Again, it's not something that you'd know that you would have without having an eye exam. So that's one of the great benefits of having regular eye exams, is to catch that condition early.
Yeah, because these conditions can be preventable and or treatable, right?
Correct, yes. And that is the key, is catching these things early. Macular degeneration is another example of a condition that if we catch it early, we have a much better chance to treat it and maintain good vision. And there are a couple of forms of that, wet and dry, and various ways of approaching that. But again, the key there is getting it diagnosed early and getting the treatment that you need.
Yeah, are there specific symptoms that would require maybe an urgent eye exam?
Certainly, a sudden loss of vision or significant pain, eye trauma, chemical exposures, that kind of thing, would be certainly prompt a more urgent exam. Things like flashes and floaters are a very common condition. If you're having a change in that, or a shade or a curtain sensation over your vision, those can be signs of a retinal detachment that we'd want to see you for, fairly early. But really, common sense goes a long ways. And if you're noticing a change in your vision, something doesn't seem right, you should get in and have it evaluated.
Yeah, definitely call. What are the recommendations for adults over 65 in terms of how often they should get their eyes checked?
Adults age 65 and over, usually every 1 to 2 years is what's recommended. If you're diabetic, an annual exam is typically recommended. And certainly if you have conditions like glaucoma or macular degeneration, more frequent exams and treatments would be indicated depending on your case.
Well, that is great information. Dr. Anderson with Wolfe Eye Clinic, we really appreciate all of these details, especially as we celebrate Healthy Aging Month.
Well, thank you for having me.
And you can learn more about the services offered at Wolfe Eye Clinic by going online to wolfeeyeclinic.com. You can make an appointment or ask questions by calling 833-474-5850. Wolfe Eye Clinic is located at 6200 Westtown Parkway in West Des Moines. If you are planning a wedding in the Metro, our next guests are going to tell you about a hot new place in Ankeny. Stay tuned for that.